Hello, everybody. Welcome to the Career Opportunities on Healthcare. My name is Ajay Iyer, and I'll be doing the first part of the presentation. And this will take about like 35 minutes or so. And what I'll be talking about is what are the various opportunities in healthcare. And I'll primarily talk more from the clinical side of things. So that's why it's titled, Medical Healthcare Career Opportunity Beyond the Obvious. So here, typically, when we go to a hospital, okay, and I believe everybody has gone at one time or the other, and even if you're someone younger, there's a very good chance probably you were born in one. So healthcare is one of those things that we all experience pretty much from our birth, and there's a very good probability that pretty much at the end of the tail end of our life, we may encounter a lot of hospitalization. So it was something that's there from beginning to end for most people. And when we talk of healthcare, okay, or in general, even more specifically hospitals, the typical image that comes to us is a doctor or a nurse, and that's the typical image. And generally, most people typically think that those are the big opportunities there, which they are. But there are a lot of other opportunities there. Okay? So I'm not going to focus heavily on the doctors and all, because that's, of course, most of you probably already know that you can go to medical school and get your degrees and pursue it from there. So another thing that reminds us of typical hospitals is anytime we see an emergency ambulance van. So that is another thing that reminds us of a hospital. And here's what I was just talking about. You can see pretty much every phase of life, there is some interaction that we have either with a doctor or with a hospital if there's an accident or anything. And pretty much it's one service which we experience pretty much practically from cradle to grave. And there's very few services in life, maybe we can say, of course, food is one. As a consumer, we use it. But as a service part, hospital, pretty much from birth till end of life, we'll be encountering this. So before I go into details, what opportunities are there, let's look at what is the market here, because that's very important, right? We want to be in a growing market where we know that the industry itself is growing, okay? And so I'll give some comparison just to give an idea on how much opportunity is available in India. So if you look at India's healthcare spending, that's only 3.7% of GDP, and our GDP is about 3.2 trillion. So our annual healthcare spend comes to about 118 billion or so, and that is for a population of 135 crores. Let's look at on the other side, okay, for US, okay. Their healthcare spending is 17.7% of GDP, absolutely huge number. And their GDP is 21 trillion. So basically, if you can look at it, their healthcare spending is around 3.6 trillion. And that is so the population is only 32.7 crores in US. So if you can just look at this number, their healthcare spending is bigger than the entire GDP of India. So I want you to just imagine for a moment how big it will be. Just think of it, if everything we do in India only related to healthcare, we'll still not equal it, but we'll come close to the US spending in healthcare. So as we grow, eventually healthcare percentage will go as the economy becomes bigger. And this can tell you how much opportunity is there in terms of healthcare. So this is something that's going to keep growing and growing and growing. So from the opportunity point of view, is it a sound opportunity? Absolutely. The numbers are telling you. And as the nation becomes more developed, more the healthcare percentage of spending keeps going up and up. And you see that especially in the US. And that is pretty much in the same range for most European countries now, at least all the Western European countries. Now, another interesting thing that is happening in India is, or around the world, is life expectancy. Now, why is this an important factor? Because as people are living longer and longer, they need more and more healthcare. The older the person gets, the more amount and more services are needed to ensure the quality of their life. So if you look at it, just look at 1960, the life expectancy in India was just around 41, 42 years in 1960. And in the same time in Canada and US, it was close to almost 70 years. Now coming to 2016 or 2017, in India, the life expectancy has reached almost 68, 69 years. And it's plateauing for US and Canada, and that's come close to almost 80. For Canada, it's almost 83 years. Now, interestingly, what is happening is in India, the numbers are a little skewed. And why do I say skewed? Because this is for the entire Indian population. And we pretty much know, at least those who live in bigger cities, that people in cities have better healthcare facilities. And if you come from a more educated family, middle class, there's a very good chance that our lifestyle in that category is a little higher. And maybe in the villages and in the lower socioeconomic bracket, it's lower. So it averages out. But depending on our segment, typically middle class is a little higher. And we can see it in our homes itself, right? Our parents, uncle, aunts, many of them are already in the 80s or late 80s that they are living up to. So what that tells us is opportunity will only increase, because as the population lives longer, more healthcare is needed. So I'll take a very simple approach. Unfortunately, I'm not able to see you guys, so it's looking more like a lecture. It's being more interactive, so I apologize for it. So we'll just go over what are the various opportunities, and we'll take over a patient life cycle, from here, what happens from admission to discharge, and we will go over all the various touch points and look at all the career opportunities that one can be engaged in. Emergency, hope we never experience it, but it happens in life. Pretty much you will always see doctors, nurses, paramedical staff, a lot of it, okay? Nursing's huge part. See, nursing generally, when I talk to people, people have and this is just a general idea, because they think all nurses are same. All they do is, take care of the patient, work with the doctor and all. But nursing is a specialty. So there are over 100 different variations of specialty for nurses. So this is a very specialized field. So it's no longer the same thing, a nurse is a nurse. No, it's not. Okay, yes, there are general nurses, and as I go further in the slide, you will see that. But there is for each area, there's a specialization that nurses can do. And especially in Western countries and all, nurses get paid very well, because pretty much they are the right hand for the doctors. And you see that, taking care of the patient, okay? One big area of career opportunity is on the laboratory side. And this is something all of us have experienced, right? Anytime we go to a hospital and we want to see a doctor, you visit the doctor, do the first consultation, and the doctor gives the entire list of various tests, blood tests, urine tests, whatever it is, right? It's a whole battery of tests that you need to do. So practically everybody has to go to the lab to get some tests done. And that is done by various technicians, who take the sample out, and then, there are very fairly sophisticated machines to do various types of tests that can be done. So again, this is a specialized area, and one can be a medical technician and can get trained in it. There's a formal education to do that. And practically every major hospital will have an inbuilt lab within the facility, and smaller ones will outsource it. And even there's hospitals where there is a lab in-house, they don't do all the testing, because there are hundreds of tests that can be done. So they do the most common ones, and anything else that they don't do, they will outsource it to a reference lab, which will be even more specialized lab that caters to all these not so frequently used testing and all. So that's one area. The another area is on the radiology side. Now, the most common one we see is typically the X-ray. But today, the field of radiology has absolutely taken tremendous technological leaps. So here what I'm showing is an MRI machine, okay, becoming more and more common. The person who does it, of course, doctors are there, but there are radiologists who set up the patient, take the scans, and then, and then there are, of course, doctors who specialize in, who write the reports and all. So here's the X-ray, very common, very, very common. And anytime, you have any sprain, anything like that, they will take an X-ray. So again, this is all comes under radiology. And again, within there is specialization. So that generally you will find a lot more people doing X-ray technicians and all, but then you can specialize into MRI and other sophisticated machines that are there. So here's, a radiologist studying an X-ray, and then he'll write the report on the findings of this. And of course, then the report goes to the doctor and they take the next steps, whatever needs to be done. Another huge area, super specialization, operation theater or any surgery. So of course, doctors are here, we are talking about surgeons here, but all the nurses are very highly specialized here. And you will find about 3 to 4 nurses typically in any surgery that is happening. So there's a whole battery of team that does it. And everybody is basically specialized and has some very specific role that they do here. And this is to ensure that everything goes smoothly and, and the surgery is successful. So, and that's a very simple rule. I think that applies to anything in career, but more so in healthcare. The more specialized you are, the more your value, the better your salary or your income earning potential there. And that's why surgeons make far, far more money, okay, than typical what we call is a family practitioner. But by the same token, the demands on the knowledge and the skill is also very high on a surgeon. And same thing with a nurse who specialized to support any or works in the operation theater. So more skill, more specialization, and more experience, better opportunities, both money-wise and career-wise. So here's like all the setup and all is what the nurses do. Every instrument is set at a particular place and all that stuff, because there is no thinking there, When they do operation, they exactly know where any of the instruments is placed for them. This is another huge, huge area. Anytime, let's say, once the surgery is done, the patient is brought into the ICU and, now they are recuperating. And usually for 24 hours or so, they'll be under monitoring. A lot of equipment is used. So one area which is not directly involved with hospitals, but is a huge growing area, is biomedical engineering. So biomedical engineers are those who have a knowledge of biology and engineering, typically mostly electronics and some mechanical engineering and all. So these are the people who design all this equipment. Okay, and of course, they work with the doctors also. So huge, huge area, because as as more healthcare spending improves and people demand better care, you need more of this equipment, because this is what improves the quality of care. Or one key factor in improving the quality of care is better monitoring of the patients before or after surgery. So biomedical engineering is great opportunities, and many of the bigger companies, you will see General Electric, Philips, all those people are very big in this area, in the instrumentation area. Something we usually forget, meals is a big thing. See, every patient has to be fed. And this is not what we call a typical meal, that you order in a restaurant. Each patient gets a specific diet based on the condition they are in, the type of treatment they are getting in. So now who makes all these meals? And that's where you get a dietitian or a nutritionist. Uh, yeah, this is the person who works very closely with the doctor, okay, and writes down what we call is a meal plan, which is very specific to that particular patient, depending on the patient's condition, that the type of treatment that is going on, etc. And this includes breakfast, lunch, everything else, dinner, everything. Huge area. Now this area is also, you will find a lot of dietitians outside of hospitals. You will find them specializing in, let's say, in the physical training area. You go to many gyms, they may recommend you. And then also being the outpatient, where let's say if you are a diabetic or you are a heart patient, you can, these are the people who give you your diet plan, what kind of foods you can eat, and exercises you can do, all that stuff. So again, huge area, because every hospital has dietitians. And it's a great field because you can work outside the hospital too. So the opportunities are even much larger. And anybody who has heard of Rutuja Divakar can tell you, right? Again, like if you're specialized and if you're really good in your field, sky's the limit. Again, chefs. Usually people don't relate chefs with hospitals. But again, as I said, the food is a very specific combination, right? The dietitian says, hey, this kind of food has to be prepared. So all these people are trained very well to make sure that the nutritional value, the caloric value, and everything else that needs to go to cater as per the recommendation of the dietitian is prepared. So this is another, you won't see them in the front, but yes, they are very trained people. Again, this is a specialization here. Okay, so another great opportunity. So somebody who likes cooking and somebody who wants to serve people can seriously consider this opportunity, being a chef in a hospital. Another big area is like practically anytime you go to the hospital, you get medicines. Okay, so who handles the medicines? So one area is, of course, I'm not going to go into the manufacturing part because that's a whole, directly, it doesn't come directly under the hospitals or healthcare, but it's a related field. The biggest position that you will see in catering to this field is what we call is a pharmacist. So there are really two types of pharmacists, not from a difference from education point of view. There are one who typically will manage the various pharmacies. So if you go to a hospital, you see a pharmacy, generally there'll be a pharmacist. But there's also a pharmacist, that's all hospitals have another pharmacy, typically either in a basement or some area that is not visible to the public. They cater to the needs of the hospital, especially of all the inpatients who are there. There's a whole regiment of medications that is given to them. At morning, afternoon, depending on the patient, the dosage, etc. So these are the people who work behind the scenes to make sure for that medicines are being delivered to each of the patients, the right quantity at the right time. So medicine comes as and when is needed for the patient and is then administered by the nurse. Huge area. Of course, pharmacists also work in the pharma industry, in the various manufacturing aspects and testing aspects and all. But every hospital has a need for pharmacists. Generally, there will be multiple pharmacists in a hospital. Excuse me. Another big area. Now, this is a very growing area. I believe India has only like less than 20% of the patients who have health insurance. So compared to if you go to US or most of the Western countries, this number is over 80%. So you can imagine the growth. So this is not a clinical area in terms of, but to process the bills, you need to have some clinical knowledge because that is how the doctors communicate what all work has been done on the patient, and those specific codes, which are basically very medical terms, somebody has to interpret and make sure that the right procedures have been done, right medications have been given, and there is no overbilling, incorrect charges and all that stuff. So that insurance sector is huge. So this is another area somebody can specialize in. And here, both either in the hospital side or on the insurance company side. So in insurance company, you can work, or typically what we call is third-party processing companies. So these are the companies that are a buffer between the hospital and the insurance company, and who do the processing and all that stuff. So that's another huge opportunity. And this will be growing in India as, again, as I've said, as the nation develops and more and better literacy happens, more education happens, and more people are getting insurance. This is a growing field. Now, something you don't see heavily in the hospitals. Okay, I say heavily means some hospitals, yes. So what happens when a patient, let's say, gets out of surgery or any treatment? So many of them may require some physiotherapy. All right. So you may have some physiotherapists in the hospital, but there are outside of hospital, typically in an outpatient scenario, you'll find a lot of physiotherapists who can help you. Okay. So huge growing area. And as the population ages and people live longer, there's a more and more need for physiotherapists, because people, sprain their legs more easily as they age. Okay. And because, or sometimes they can fracture their legs. So for all these things, once the treatment is done, people need physiotherapy. Huge opportunities. So this is one area where physiotherapists can come to your home, or usually many outpatient clinics will have physiotherapists. So you can just go in there and get your sessions done. So great opportunity to consider as a physiotherapist. Another hugely growing area now, especially if you look at US and most developed countries, this is a multi-billion-dollar industry. Okay, but this is also becoming big in India now. It's growing, nowhere close to what you'll find in US or Europe, but definitely growing, because as we are getting more and more two-income families, the extended family system which we used to have, where always there were some elders in the family who will take care of others. As that is breaking down, a lot of people are forced to put their loved ones under a long-term care. So there is a good care available. They are taken care of while, without interrupting their lives to a greater extent. So long-term care is another. So these are, again, literally like facilities. And again, they have the doctors and they have nurses and everything else. But the idea is that the patient is going to be there for a longer term, 30 days, 60 days, 6 months, whatever it is. But, okay, so these are areas for recuperation. Again, another growing area, and in a country like India, this will become more and more as affordability increases, as people are earning better and they themselves are not in a position to devote the time and energy to take care of their loved ones. So the same way, another area is what is hospice care. So hospice care is pretty much long-term care. Is like somebody's recuperating, eventually they will get well and go home. Hospice is pretty much like literally it's called end of life care, where doctors are pretty much given hope. All they know is this person is pretty much at the tail end of their life now. And whatever needs to be done to take care of them, whatever that short time is, that is called hospice. So here, basically, we know that the patient is going to pass away, but they still get very good care for whatever time or whatever is remaining for them. Again, great opportunities for nursing and doctors, but primarily heavy nurse-based operations that happen here. So again, so if somebody really loves people and have that compassion, this is a great area to serve. Now, other areas, sometimes, of course, you won't find this in hospitals, but it's very important, being a dentist. Okay, most of us go to dentists very regularly, so great opportunity there. Then you also have something called a dental assistant. Okay, so the lady there, she's not a nurse, she's called a dental assistant. So again, a great opportunity, again, a very formal education you have to go through, and you can become a dentist or a dental assistant. Okay, and again, many of the equipment you see, they all come in the field of biomedical equipment. So here, another area is, okay, this is dentistry again. Okay, so practically a lot of people. Another area that gets overlooked unless you start wearing glasses is ophthalmology. So there are literally three categories of people in this domain. One is the ophthalmologist, is basically the doctor, right? And they are the ones who do any, if you want any surgery or procedure done in your eyes, they are the ones who do it. Optometrist is the one who measures and takes all the readings for your glasses and all. Opticians is the one who actually makes your glasses. So the highest skill level is being an ophthalmologist, and the lowest is, of course, an optician. But again, a specialization. You have to go through formal education, and again, this is a huge area. As people are living longer, and more people are using internet, and spending hours on the screen, you can see more and more people wearing glasses. Okay, I'm wearing glasses too. Okay, so huge opportunities, and you can pretty much know the size of the opportunities. And if you live in a city, the number of optometrists and eyeglasses stores like Lens Crafters and what are the other ones? I think, yeah, spec makers, and there are a lot of other local chains. So huge opportunities, because this is again growing, and more people are becoming serious about doing regular eye checkups and all that stuff. So great opportunity here. So here's an optometrist, okay, taking the measurements of the various this thing for the eye checkup, and if the eyes are in focus or not. Another area completely gets overlooked, but a great area is audiologist. What does the audiologist do actually? So these people specialize in hearing. Again, a very formal education. It's a 4 years of intensive studies just for a year. So it's hard to believe, but again, a very specialized area. Again, a growing area. Why? Because as people are living longer and longer, their ears are getting weaker, and then these are the people who do the testing and recommend the hearing aids, etc. So again, a huge growing area and fairly well paid jobs here. So if I have to summarize everything, the medical field, of course, is absolutely growing, and it will continue to grow. There's no doubt about it. But what separates healthcare from many other fields is it's all about expertise everywhere, especially on the clinical side. Now, one area I didn't talk about is all the non-clinical jobs, like the billing clerks and the cleaning staff, and the people in the procurement who buy the medications and, the beds and everything else. Okay, and then the maintenance staff that manages the building, the electrical power and everything else. So I'm not even talking about that. Anyone with a generic education can get there. But clinical is, you have to go through a specialization. So this is all about expertise. And that is what makes healthcare a little harder. Why healthcare is expensive? This is one of the major reasons, because it's all about specialization. And anywhere, and practically everyone is specialized here. So, and the more you go, more specialization is required in any field. That particular field, the services will automatically be expensive, because you are paying for talent now. And of course, the criticality, because mistakes can be very fatal in this area. The other key element in healthcare that is very important, it's all about excellence. And we all can relate to it, right? See, when somebody, our loved ones, or if we ourselves get admitted in hospital, what is our first requirement? We want the best doctors to give us the best service. This is one area where you don't go and start negotiating for cheaper rates. Correct? Would that be right to say? Because we say, hey, man, it doesn't matter. And of course, it depends on one's financial capacity. But by and large, anybody says, hey, I want the best doctor, the best care for my loved ones. And everybody demands excellence. Because when it comes to life and death, we all want excellence. Nobody wants to take a chance and say, hey, put a cheaper doctor for me. Nobody ever says that. They want, so the entire industry runs on excellence. So that is another very unique characteristic of this industry. Everybody wants excellence. not only wants, basically people demand excellence in this industry. And the third and the most important factor is credibility. And again, it all gets down to specialization and high integrity, because this is one industry where hospitals and even doctors uh, live and die by their credibility. Anytime a hospital gets a bad name for any reason, it could be the staff is careless, the staff is rude, they don't provide the best service, the billing is incorrect, the food is not good, hygiene is not maintained. Any of these things, if you start looking at it, it impacts the credibility. And none of us will ever go to a hospital where we have heard has a poor credibility, because nobody wants to risk their loved ones there. So again, this is, if you look at the opportunity point of view, it's a great industry, because this is one industry that demands the most out of everybody. And especially when you're an inpatient and you are given the responsibility to take care of somebody who's not in a great shape, the entire family counts on each of these people. So with that said, so I think I forgot something in my excitement to get going. So just to give you my background, so I come from an IT background, and so for over a decade or so, I've worked in the healthcare IT, which is again a specialized area. So what is healthcare IT is, this is where all the hospitals, especially on the clinical side, we use a lot of specialized software and all, and especially what we call electronic medical records. So I was managing a very large team here for a MNC, supporting hospitals in the US. So pretty much supporting all the clinical staff, hospital nurses, doctors, nurses, pharmacists, the lab technicians, whatever work they do and all. So we used to support all that. So I have a first-hand knowledge of how hospitals work and all. And most of my work I have done in the US, and then of course I came back to India, and now I'm staying in India. So I hope you learned a lot, and I apologize because it's not two-way. It's not my typical style. But with that, now with everything how does a career in healthcare sound to you? It's a great career, because you can truly see that when we talk about the concept of service, this is one field where you can actually serve somebody and still make a decent living. So I got into this industry over 10, 12 years ago, because definitely the idea appealed to me and something I wanted to do. But I had one personal challenge. I cannot tolerate blood and all that stuff that goes on. So coming from a technology area background, I decided to go into IT, and of course, and then come to healthcare IT. So yeah, I'm still serving, still making decent money, okay, and still living my dream, but without the other parts that doctors and nurses go through. So that's another way of getting engaged. Biomedical engineering is another way you can get engaged. Pharmacy and many of the other areas, right? Dentists and audiologists. All those areas are there where you don't deal with too much blood and very many of these traumatic situations. But if you can handle that, that is another great area to go. So that is something for everybody, and anybody who wants truly to serve and still make a decent living. This is an awesome area. So if you have any questions, you can put it in the chat. And Arvind, so how do I get to the chat window? I don't know how. I'm not able to see that chat window here. Okay. So yeah, if you have any questions, you're welcome to send it to me in the chat, and I'll answer that. Yeah, I'm sure the one you're talking about, MBBS, is pretty much that is. I didn't cover it because that's pretty much most people know. But MBBS is you take the biology stream, right? And biology stream, and then you go into a medical college. Yeah, Rutuja, yes, I come from the healthcare IT background. And I think, as I mentioned in the last end, this is where we maintain many of and support the doctors and all on many of the IT applications, especially what you call is, electronic medical record. See, this is very common. It is mandated by law in the United US. So my team used to support only US hospitals. Okay, important to do MDS. Yeah, Vivek, it all gets down to the same point is specialization. See, this is a field of specialization. So the more you are specialized, the better it is from a career perspective for you. Yeah. So Padma, dietitian is you can go to I don't know the exact colleges, unfortunately, because most of my professional life I spent only in the US. So I probably know more about the US education system than Indian. But the dietitian, again, you have to go to a college, and that's usually typically it'll be like a 4-year college where you can study and become a dietitian. I think practically every major city has very good schools, where you can pursue this. Yes, Rituja, your question is, you're a physics, chemistry, biology student, right? Yes, you can absolutely. So what happens is look for colleges that have either there are two ways you can go. Generally, it could be in some colleges, biomedical can be a full-fledged 4-year degree, or in some it could be a minor. So just look for biomedical engineering. Now, okay, so your other question you're asking, biomedical engineering is very different from biotechnology. Biotechnology is more biology based. Biomedical engineering is, let's say, 30-40% about the human body. You understand, need to know all that stuff, but it is primarily engineering. So one is engineering and one is biology. So, so if you want to pursue an engineering career, designing and building this equipment and all, then you pursue biomedical engineering. So in biomedical, you will learn electronics, primarily a lot of electronics you're going to learn, and a lot of about instrumentation, etc. Rachel, your question is, what course would you prefer the most if you want to work abroad in medical field? Okay, what my typical suggestion when I get this question is, don't worry about what is abroad, because you cannot. What I typically advise is, don't chase what the market wants. Do what you are passionate about, because markets can change tomorrow. So if you look at medical, just the hospital care, healthcare, the last 20-30 years, there have been dramatic changes. Okay. So if you were just looking for some job opportunities, that job may not even exist today. But if you follow what you really are good at and what you're passionate about in this area, you will always find opportunities everywhere, whether India or abroad. Physiotherapy is great, it has amazing opportunities. One of the points, if you recollect, Arvind sir, just let me know when my time is up. Uh, uh, so, yeah. Okay, I'm sorry, Vivek. Okay, I'm sorry. Let me 1 second. Is there scope for biotechnology after 2020? I'm not getting the question. That's a huge. This is a very growing field, biotechnology. So a lot of research is happening in that area. So yeah, it means I don't know if somebody is saying there is no field. I'm not aware of this thing. Okay, physiotherapy. Indonesia, great opportunity. Now, if you recollect, one of the points I had made in the presentation was, as people are living longer, right? Yeah, let's say 70, 80, their bones and all usually get weak, and they are more prone to this thing. Second is, a lot of people are doing exercises. So physiotherapy is not just in hospitals. Physiotherapy is like, I'll give an example, is sports physiotherapy. Again, that's a specialization. So every cricketer, okay, any person in sports, there are people who specialize. It's a very well-paying job, okay, because they specialize in the sports area. Why? Because how the muscles and the body is used by a sportsman in cricket is very different than somebody who's in wrestling. Okay, so all these people, so great opportunities there. By the way, just to add, my brother, younger brother, of course, he lives in the US. He started his career in IT, but then, of course, since his job required too much travel, he decided to change and he became a physiotherapist. And I believe he's been doing that for 15, 17 years now as a physiotherapist. And he says it's an absolutely wonderful be gifted that.
So
Yeah.
we can start with another presentation.
Sure. Okay. All right. Thanks, guys. If you have any
Yeah.
questions, you can reach out to Dheya. They will contact me, and I'll answer your questions. Okay. So thank you all. Appreciate your participation, and I'll hand it over to the next speaker.
This is Arvind Gupta from their team.
Yeah, doctor. This is Ajay here. The term you're looking for is actuarial. So what is? Yeah. No, but you bring a very good point. So everybody, that is, if you're very good in mathematics, that is a extremely highly paying. And in fact, I remember about 10 or 12 years ago, I was reading a survey in US. Of course, I was in US at the time, which said which are the careers which have the highest job satisfaction. Guess what? Actuarial was the number one. Most people would have never even heard the term. So this is heavily mathematics, statistics based, and pretty much an insurance company lives or dies by the work of these people. Because if they mess up, man, the company can go under. If these guys do a great job, the company thrives because the entire risk assessment, and this is not just standard stuff, it's coming with new models and coming with that is what separates a good insurance company from an average company is completely. Yeah, and but it's a very intellectually demanding work, and that's why people say it's very satisfying because it literally challenges you to come up with a lot of innovation. So thanks for bringing that up, doctor. I appreciate that. Yeah, yeah. I think, folks, anybody have any questions? Yeah. Okay. Great. Yeah. So, and Rohit, just to add one point, see, for many years, radiology work from US is coming to India actually, because now it is all digitized. There is no physical film, right? Everything is a digital image that comes. So, a lot of the technicians in US will take the image and digitally send it to India for radiologists to, write the reports, do the analysis and write the reports. Teleradiology. Oh, thanks. That's the right word looking. So this is one area that even in India you have great opportunities because you are actually doing work for. So the harder and the specialized work is coming to India. So which is great news. And there have been companies which have been doing this for 20 plus years now. So that is another great area opportunity to think of. All right, guys. With that said, thank you very much for your participation. Hope you learned.